All right, so this is my redo of my wet to dry dressing wound change. At this point, I've done everything up to hand hygiene, and now I'm gonna start with positioning my bed for my patient. And I'm gonna make sure they're comfortable before I start performing my procedure. And then at this time, I'm going to apply my clean gloves. And then my glasses. All right, at this time, I'm gonna make sure my suture line is intact, and then I'm gonna expose my dressing. I'm gonna start with the AVD pad, and I'm gonna look at the type of drainage, the amount, color, consistency, and odor using Taco. And then I'm gonna start to remove the outer or the inner layer. So again, with this, I would look at the type of drainage, the amount, the color, consistency, and the odor using Taco. And all these things I would report in my workup. And then now I'm going to observe the wound itself, and I'm gonna look at the size, granulation, if any of the muscle is necrotic, if there's any slow, any odor. And then I'm gonna gently palpate and note any kind of redness or edema, see in case there's any kind of tenderness. And then I'm also gonna make sure not to touch inside the wound. So now I'm going to dispose of the dressing and the gloves with glove to glove and skin to glove. And then at this point, I would dispose of it in the trash. And I'm going to open my kit, remove the sterile field, and making sure not to get inside those 1 inch border or that 1 inch border. And then I'm gonna take the contents and pour them inside the 1 inch border, making sure not to go out. And then at this point, I'm going to pawn the label of my saline. And I'm gonna make sure that the expiration on the saline is not expired and that it's still good. Palming the label, taking the cap up, and then pouring some in my basin. And then at this time, I'm going to don my sterile gloves, perform hand hygiene, and open my gloves. When I have my sterile gloves on, I'm going to arrange my supplies without contaminating and coming out of this 1 inch border. And I'm gonna keep it away from the door or the border. And now I'm gonna demonstrate the procedure for cleaning the suture line. First, looking at my suture line, I'm gonna assess the size. It's a large suture line, and then the edges are approximated. There's no drainage, no different color, and it's consistent with the rest of the body. So we know that there is no sign of infection. And then looking at the suture consistency and no cause for alarm. And now I'm gonna take a 4x4 gauze. I'm gonna wet it, getting any of the excess off. And now I'm gonna take it and rub it across my suture line. Starting at the the least contaminated and going to the most. And now I'm gonna dispose of it. And now I'm gonna take a draw 4x4 gauze, and I'm going to gently pat with dry gauze. Disposing of it. So now I'm going to take a 4x4 and I'm going to move on to the wound. I'm going to wet it, getting rid of any of the excess saline in it. I'm going to fluff it out. And pack it into the wound. Pack it into the wound. And then at this time, I'm gonna take a dry gauze and place it on the outside after packing the wound, and take my ABD pad and place it on top. And then I'm gonna remove my gloves, glove to glove, skin to glove, perform hand hygiene, and then I'm gonna take my tape and place it around the ABD pad. Making sure just to touch the ABD pad. All right, and then I would take a piece of tape, write down the date, time, and my initials, and I would put it on the outside of the dressing. And then I would at this point, reposition my patient for comfort and then raise the side rails. Perform hand hygiene. And then I would dispose of my supplies. And then dumping my basin out. So at this point, I would then document the intact suture line and how the procedure was tolerated by the patient, how they took how they reacted to the procedure, if it went well, if there was any kind of type of drainage, any kind of amount of drainage, a weird color, consistency, or odor, and I would put that in the document file. And then I would also say, I would describe it and just say how it looked, the size of it, any kind of granulation, slow, odor, and then I would also talk about the incision line. Thank you.